Good morning. If you have decided to study and you want to become a professional hypnotherapist, keep watching our training videos about clinical hypnosis. Hypnotherapy is an effective technique with which you can help and improve the quality of life of a great number of future patients. Remember, read the description of this video where you can find a link to free training classes on clinical hypnosis, and also you can download several ebooks also free. The information in this video is extracted from our book Direct Clinical Hypnosis, Deep Hypnosis, of our publisher Clinical Hypnotherapy, registered with ISBN. Direct Clinical Hypnosis, Pain, Part 1. Introduction. Pain is a human experience, universal and unpleasant, experienced by all of us. On some occasion, more or less intense. Pain is a symptom that warns us that something is wrong. Pain is a subjective and objective experience, that is to say, an unpleasant emotional and sensory experience. Depending on the characteristics of the pain, we can know its origin and therefore its diagnosis and subsequent treatment. To do this, we must take into account a series of characteristics of pain: location, type, duration, frequency, intensity, irradiation, accompanying symptoms, aggravating factors, mitigating factors, etc. The threshold and perception of pain is variable and depends on the personality, sex, age, intellectual level, culture, education, previous experience, etc. of the pain patient. Pain is therefore an individual experience. Pain can be chronic, acute, physiological, inflammatory, neuropathic, visceral. Hypnosis, a very ancient technique, has proved to be effective in pain control in all kinds of disorders and as a supplement to chemical anesthesia, as all authors who have used it testify. Hypnotherapy can be a successful tool in the treatment of pain and other disorders. In medicine, pain is described as an unpleasant sensation caused by the harmful stimulation of sensory nerve endings. It is a fundamental symptom of inflammation, and it is variable in the diagnosis of many disorders. Mosby's Dictionary of Medicine, 1995. The word pain comes from the Latin poena, meaning punishment, as it was once believed to represent punishment by the gods. Pain is necessary for survival. Individuals who are born without pain sensations often damage their skin through bumps, scratches, or burns, or injure their muscles and joints. Pain protects us from our environment. Pain can be of three types: acute, intense and immediate. Acute pain is experienced by an individual from an injury, for example, from a burn or trauma. Chronic. Chronic pain is due to certain long-term processes or injuries, for example, migraine, trigeminal neuralgia, cancer pain, etc. Psychic. Pain of psychic origin may be due to the loss of someone important to the patient or to post-traumatic stress, to give two examples. Research and clinical experience allow us to assure that both physical and psychological pain are of the same type and as real as each other. Hypnosis is an ancient technique used in all cultures throughout the ages. In the Ebers Papyrus, which is considered to be a treatise on medicine, gynecology and hygiene, talks about the hypnosis used by the Egyptian priests. Those who have read it say that the technique is not very different from the present one, although its name, hypnosis, is more current. It is due to the English eye surgeon J. Braid. Braid, who published his observations in 1843, used the methods of fixing the attention on something shiny like a metal on a chain. What kind of pain can be treated with hypnosis? Both chronic and acute pain, barbicides, diabetic, peripheral, neuropathy in feet, trigeminal neuralgia, thalamic pain syndrome. The use in surgery is documented and ancient. John Elliotson, 1893, published a paper describing numerous painless surgical cases. Anesthesia had not yet been invented. Dentists have been using it for many years. Some, like Kroger, published a 3-volume treatise on clinical and experimental hypnosis in 1963. If you're interested in learning more about clinical hypnosis, watch our next video, Direct Clinical Hypnosis, The Pain, Part 2. Remember, read the description of this video where you can find a link to free training classes on clinical hypnosis. And also, you can download several ebooks also free. If you have any questions, add them in the comments area. On this topic and many others we'll talk about in the channel and in the videos that we'll publish. So, if you're interested, do not miss our next videos. Thank you very much.